Good afternoon, everyone. We see lots of folks jumping on. Welcome if you're joining from Zoom or if you're watching live on Facebook. This is the webinar hosted by the Gray Muzzle Organization featuring Dr. Mike Petty. We are delighted to have all of you join and jump on. If you are new to our Gray Muzzle webinars, first of all, welcome. We are so glad to have you. Feel free throughout the next hour to drop into chat or into the Facebook Live feed any questions that you might have for Dr. Petty today, and we will save some time at the end of the webinar to open the floor for discussion and get your questions answered. And it's also always fun to have you let us know where you're joining from, what part of the country or potentially world that you're joining from. So please go ahead and drop that in chat or Facebook comments. And of course, for our love of senior dogs, we would absolutely love to hear the name of your beloved senior pet or pets. In my case, at the Chico's household, we have 4 dogs, 3 of whom are seniors, and our most recent adoptee is Jojo. He is a 12-year-old blue tick coonhound that we just adopted. So welcome, Melanie. You're in New Hampshire, and you have 2 senior dogs, Otis and Annabelle. Oh, that's wonderful. Thank you. And in case you missed the big announcement yesterday, senior dogs certainly have something to wag about today because the Gray Muzzle Organization announced a record-breaking $848,000 in grants awarded to 90 very deserving animal welfare groups in 29 states across the United States and also Puerto Rico. So this is incredible. It was thanks to you. Thank you for all of your support. That brings the Gray Muzzle's grand total over the last 15 years to $4.6 million that have been awarded to help save and improve the lives of senior dogs. And this is just incredible. Thank you so much. We are very excited to announce that record-breaking year, and we appreciate it so much. Sharon, welcome from New Jersey, and your senior dog, Peter, who's 15 or 16, fantastic. And Verena from Florida, you have a 12-year-old dog, Callie. Welcome, everyone. Glad to see you all here today. We are about to kick off today's webinar on the effects of pain on behavior. And we know that pain affects our pets' lives, sometimes even more than we realize. And many, if not most, behavioral issues are related to pain. And so this is an important topic to everyone joining and those who will watch the recording later. Again, if you have questions, please feel free to drop in chat or the Facebook comments, and we will address those at the end of our webinar today. So please allow me to introduce our incredibly talented and experienced facilitator, Dr. Michael Petty. Dr. Petty is a veterinarian, a certified veterinary pain practitioner, and an acupuncturist. He is a current member of the World Small Animal Association Global Pain Council and the past president of the International Veterinary Academy of Pain Management. Within this sphere of care, he has expanded his knowledge to encompass the most up-to-date and compassionate treatments available. And these special skills include certification in pain management from several esteemed organizations. His credentials include certified veterinary pain practitioner, certified medical veterinary acupuncture, and certified canine rehabilitation therapist. Dr. Petty is a frequent speaker and consultant, and he serves in an advisory capacity to several pharmaceutical companies on the topics of pain management. He has traveled to clinics across the country and the world to teach about pain management, both feeling pain and the inability to feel pain, and to improve the diagnosis and treatment of chronic pain. He co-authored the American Animal Hospital Association, American Association of Feline Practitioners 2015 Pain Management Guidelines for Dogs and Cats. He is a frequent contributor to veterinary journals, and his popular book, Dr. Petty's Pain Relief for Dogs, was published in 2016. If you haven't got your copy, please pick up your copy after today's webinar. That is Dr. Petty's Pain Relief for Dogs. He has also been the owner of Arbor Point Veterinary Hospital in Canton, Michigan since 1985. And when he's not working, he enjoys gardening, reading, and traveling. He lives on a horse farm in rural Michigan with his wife and 2 daughters, along with Alvin, a rescue cat, and Kiki and Kai, both Portuguese water dogs. My goodness, Dr. Petty, we could not be learning from a more qualified individual today about the effects of pain on behavior. So thank you so much for joining us today and sharing your knowledge with this audience.
It's an honor to be here. And thank you for giving me the opportunity to talk to you about fear and pain. And, I have long suspected as a practitioner that, I've noticed that the animals that come into my clinic, the ones that are showing fear and anxiety, always react more strongly to any kind of painful stimulus, or that either we do, like an injection, or that they come in with like an injury. And it was kind of hard at the beginning to decide which came first. And honestly, in majority of the cases, it's the fear and anxiety that come first. So I'm going to go through and I'm going to talk a little bit about the reasoning behind that. I've got a couple of slides on some new quality of life scores and pain assessment scores that are coming out. And I'm also going to talk a little bit about how to recognize pain in animals in a very casual way without an examination. So here we go. And I'm happy to stay on and answer questions at the end. So my thoughts on it, many of you have worked in shelters or have worked with fostering animals, and we've all seen it in acute pain cases, things where there might be a fracture, a bite wound, or maybe the veterinarian didn't do a very good job in postoperative pain control. And so that's fairly easy to see acute pain because animals are reacting and you can usually tell what they're reacting to. But I've also always suspected that chronic pain and behavior issues were related. And it kind of took smarter than people than me to figure it out. There was this really great article put out by Dr. Daniel Mills and a whole host of other people, including third in line Margaret Gruen, who knows everything there is about pain, especially in cats. And they looked at pain and problem behavior in cats and dogs. This is a free open article. You could actually, if you search the article or for pain and problem behavior in cats and dogs, I believe it is a free download. You could read the whole thing, but it is long. Brief summary, the prevalence of the role of pain in problem behavior may be as high as 82%. That's like really, really high. And although I've always looked for pain and behavior issues, I'm more often these days with a client comes in with a dog or a cat that has a behavior issue, I'm really trying to look to see what's the source of this. Where is pain playing a possible role in this? No one knows the actual mechanism for this. So we now ask that we treat any suspect pain first, and then if the behavioral issue isn't resolved, do it the other way. We don't do it vice versa. We don't try to treat the behavioral issue first. And I want to talk about a case on the human side, and this has been around for a little bit. It's recently gotten a lot more press. There's this woman named Jo Cameron, and she was born with the inability to feel pain. And as you can see, she doesn't realize her skin is burning unless she smells it. She has burned her arms in the oven, feels no pain to warn her that it's happening. She's gone through a broken arm, childbirth. She once tripped, fell in the concrete with her and knocked her front teeth out, burns, cuts, etc. It has never hurt. She has never felt pain. And this is the really amazing part. She has no idea what anxiety feels like. She has never been afraid of anything. Let that sink in for a second. There's got to be a connection between those things. And that paper that I showed you previously helped show that. What if fear and anxiety stems from knowing what pain is? So we're going to talk about some pain behaviors and diagnosing, and these are tools that veterinarians often use. The really popular one these days is called the CBPI. It's the Canine Brief Pain Inventory. It's a very short questionnaire, and it was actually adapted from a human questionnaire. And it's probably the most commonly used pain survey for approval of new pain drugs. But there's a lot of other ones out there: the Cincinnati, the Liverpool, Osteoarthritis, Helsinki, Feline Muscular Pain Index. And what's important about all these? They all rely on changes in behavior to measure pain. As a matter of fact, our clinic has been involved with over 16 FDA studies, and a lot of them for new pain drugs. And one of the dogs that we are not allowed to have in for measuring pain is Huskies, and Huskies and Malamutes, the northern breeds. And think about it. Why is that? Because they scream and holler about everything. That's just their reaction when they're being worked on. So it's really hard for anyone to look at these dogs and say, is this a painful reaction, or is it just being a husky? So I'm going to talk a little bit about, I realize this is mostly about dogs, but I'm sure most of you have had experience with cats as well. And so I'm going to, throughout this, briefly mention cats. So with cats, the number one changes that we see is reluctance to play, house soiling, reluctance to groom, reluctance to climb or go downstairs, and then also using furniture to jump up or down from a height, or just refusing to do it at all. With dogs, similar, with the added change of reluctance to walk on slippery or uneven surfaces. So what kind of changes do we see when this happens? We may need to start considering emotional and cognitive changes as well. How many dogs have cognitive function issues that are really secondary to pain? This is a known issue in human medicine, and it's been a known issue in my practice for a long time. When I see dogs come in, and they are often there, and many of them want to leave the veterinary clinic as soon as they can, but they'll walk over to the hinge side of the door. They know that the knob is the magic part of the door that opens it up, but sometimes we'll get senior dogs that walk over to the hinge side and stand there. And people will report the same thing. Dogs will go over and stand at the wrong side of the door to get out, maybe even stand at a full-length window, like you're going to open that up, whatever. These are cognitive changes, and that we often see with senior dogs, and it's often been blamed as a kind of dog dementia. But many of these dogs are in pain, and they just have this absolute fog in their head, and they really can't think about it. So it's hard to think of anything else if something hurts. And a colleague of mine, Ralph Harvey, said, the man with a toothache cannot love. And he actually told me that actually it was Sigmund Freud that first said that. When you have something that is in the back of your head that of pain, you just can't get it out of your mind. And it's really hard to think about anything pleasurable. It's hard to think about getting through your day-to-day stuff. Another human example, Emily Dickinson suffered from chronic pain, including iritis, which is an inflammation of the eye, and nephritis, which is an inflammation of the kidney. And she had many psychological issues. And oftentimes her poems reflected her pain issues. There's one that makes me kind of sad, I think about it, but she says, pain has an element of blank. It cannot recollect when it began, or if there were a day when it was not. It has no future but itself. Its infinite realms contain its past, enlightened to perceive new periods of pain. So it really does become an all overwhelming issue with us and our pets. So let's talk about some of the emotional changes associated with osteoarthritis. And these have all been, clinically proven. And I have citations off to one side. Irritability, aggression of other animals and people, whimpering, decreased social interaction, and attention seeking. Out of all those things, whimpering, vocalization is usually not associated with arthritis unless the dog does something that aggravates it in the moment. And, I'll tell you right now, there's a brand new drug that you may have heard about. It was just approved for use in the United States. It's called Librela. And my dog, my oldest dog, Kiki, has got some arthritis in her elbows that are associated with some jump down injuries. And I've done a lot of things over the years: platelet-rich plasma injections, NSAIDs, laser therapy, acupuncture, et cetera. And as veterinarians, we're always challenged by our own pets. Sometimes it's really hard to get control. Well, even though Librela is approved in the United States, it's not available here. But I live 20 minutes from Canada, where it has been out. And I went over to a colleague of mine and bought several vials and gave it to my dog Kiki, because I knew I wasn't adequately controlling it. But I want to talk about aggression with other animals. She had gotten to the point where when she was approached by one of my other dogs, and that list that was given, I actually have three dogs now. One of my other dogs, especially my new young one, she would get very aggressive. She'd snap and growl and actually do some charging if the dog wouldn't let up. And within 7 days of giving this injection of Librela, not only was she barely limping anymore, she is now interacting with the other dogs. So this is a really important thing to think about when you hear someone saying that there's inter-household aggression between dogs that have known each other for a while. Emotional changes that we'll sometimes see with other pain, like inflammatory bowel disease, restlessness, irritability, night waking, confusion, loss of interest in food, and vocalizing. So sometimes we'll have problems with central nervous and peripheral nervous system diseases, and we'll get things like self-mutilation, vocalization, decreased activity, decreased appetite, and aggression. And as I go through these, you don't have to remember all these things. My point is that, no matter what it is, whether it's, arthritis, whether it's gastrointestinal, whether it's, in this case, skin, it causes issues that emotional issues within these dogs. And why is that? So there's this thing called the limbic system, and the limbic system is responsible for not only emotion. There's part of it called the amygdala within the limbic system that is responsible for pain. And, the amygdala is responsible for emotional responses. The limbic system registers the pain. So these things are like right next to each other. And, think about it. You hit your finger with a hammer or slam your hand in a cupboard door, or, hit a bumper hitch on your car. The first thing that flies out of your mouth is a 4-letter word, right? If you like to use 4-letter words, but and it's because there is an emotional response. And not only that, there's also this delayed emotional response. So there's this feeling of, dang it all, I just did this. But then if it's something chronic, like maybe you cut yourself, 4 or 5 hours later, as the C fibers have kicked in and you've got that low throbbing feeling in your finger, you start to become self-recriminating. Why was I so stupid? Why did I go so fast? Why didn't I just slow down? And I just recently experienced the same thing. I was hurrying. I pulled a steamer out of the microwave that had some vegetables in it, and I was going over to the sink to dump it, and I was in a hurry, and I fumbled it, and it hit my foot, the boiling water and the steam, and I couldn't get my tennis shoe off quick enough, and I got some second-degree burns. My skin bubbled up, and so it hurt. And yes, I said, damn it all, when I did it. And then 4 hours later, I was feeling, why was I so stupid to hurry? And it's like, you can't help it. Even though I know intellectually why it's happening, I felt like a moron that I did it. If I'd just gone slower, if I had maybe used, hot mitts, if I'd done something else, I wouldn't have done this. So it has a big emotional effect. So I'm not, this is kind of a complex thing, but we already talked in the bottom right about emotional responses. But with this, the chronic and the amygdala hyperactivity, but the blue boxes up on top is really more about the effects on chronic pain. We just stop thinking about things, we get cognitive deficits. So again, what if fear and anxiety stems from knowing what pain is? So we've talked about emotion, but what about effects on health? Mobility. We see this a lot with cats. Cats are self-grooming, and the cats that come in with spiky hair, maybe it's because they're dehydrated, but maybe because they can't reach that spot anymore. Elimination becomes really hard. Posturing to eliminate becomes difficult. In cats, maybe the litter box, the sides are too high. If you've had arthritis, even if you don't have arthritis, what's easier, walking on grass and cement or walking on a sandy beach? Well, we're asking arthritic cats, or maybe even litter box trained dogs, to walk on a sandy beach, and they've got arthritis, and it makes it hard, and they don't want to use it. So suddenly they're either becoming constipated or they're eliminating outside the box. So, this is a good picture to kind of get in your mind. The top dog, the light gray one, is how a dog normally urinates. The bottom picture is how a dog with hip dysplasia will urinate. They can't get into that squatting position. They often get fatigued. They don't sit there long enough to finish, and they walk away. And, these are the dogs that sometimes it's blamed on, oh, they've become incontinent. Well, no, it's really because they just can't position themselves long enough to finish urinating like they should. So here's a picture of, I'm going to show you a couple of pictures. These are things that you can look at. So this is the dog in the front is my young dog, Kai. And the dog in the back is my old dog, Kiki. And, when I'm in my clinic, this is how the dogs come in. There's some dogs that are just reluctant, don't want to come in the clinic, but the ones that lag behind and the other ones that are perky and want to go ahead. And if you could notice, you may have noticed that her front legs were where she was limping. She has that elbow arthritis. So I'm going to play these one after the other, and then I'll do my best to get them together. These are in slow motion. And this can be kind of hard to tell, and it doesn't hurt to have a video camera and take a video and watch these dogs go up. So Kai, my dog with no arthritis, is going to go up a step. It looks like a horse taking a jump. Both front feet together, landing together, back feet down. And then here is my arthritic dog. And you can see she's actually placing her feet on and pulling herself up. So what a big difference between the two of them. That's hard to see in regular motion, but if you have your dog and you're watching it a lot, you will notice that they're pulling themselves up for that. So there's Kiki or Kai, and then here's Kiki. Pulling herself up. Okay. Okay, so standing from a down position. Dogs should either stand up with their back end first or all four legs at the same time. Dogs that stand up with their front feet and then pull themselves upward, these dogs have arthritis. So you can see just popped right up. And then this is the struggle to get up. There we go. All right. So that's another good thing that you can look for. The other thing you can do is look at the stance. So we have, if you were to take like a plumb line, like a carpenter has, where it's a weighted string, and place it on the shoulder, that line should hit the back of their carapace. And I don't know if you can see my cursor or not, but so the back of the shoulder is here, and it should go all the way down and hit the back of their wrist. A dog with hip dysplasia, get the back of the shoulder and drop it down. It hits the front of their foot. Why? They're taking as much weight off their back end as they can. So these are the kinds of clues that you can get just by looking at a dog that's standing there. We also have increases or decreases in exercise tolerance. And why? There's a decrease in muscle mass. So joint support is lost, the joint feels wonkier, the strength is lost, and then it becomes this terrible cycle where adding in, then they start to increase in weight because they aren't exercising as much. And this all involves an addition of additional inflammatory mediators. Physiologic steps aren't as well studied, but there's suspected impact on heart, kidney, and lungs, and the immune system. And the effects on quality of life. So pain, we've discussed all this. We have these health issues and emotional issues that we've discussed previously. And it all really comes down to affecting quality of life. And the quality of life, then it's like the dog wonders why they're there. You're wondering why you have the dog anymore. It sits in the other room. It doesn't socialize. And lots of times when pain is not diagnosed, dogs are prematurely euthanized because of it. So what do caregivers see? It's hard for caregivers to take a look. They see something different than what I'm looking for. We see an animal that is actually limping or struggling to get in or out of the car. In our parking lot, the owner sees a cat that doesn't use its litter box, but they're thinking, my pet's not screaming, it's not in pain. Or the other thing we hear is, he's just old. Well, old dogs still like to play, right? They don't quit playing just because they're old. They quit playing because now they may not jump as high and run as far, but they still like to play. So what is the effect of fear on pain? So this is kind of the flip side. And as I said, you can't really have one without the other. And just as we demonstrated the physiologic reasons for pain enhancing fear, we have to consider the same diagrams for fear elevating pain. So what kind of evidence do we have? There's a bunch of things out there on the human side. The studies aren't really there on the veterinary side yet. But, we have on the left, all three of them, but the one I want to talk about that I think is the most prevalent or pertinent, I should say, is that caregiver distress can actually increase child anxiety. And we see this all the time in the clinic. Now, I'm one of these veterinarians that I don't want to do anything to the dog or cat that the owner doesn't see me doing, except inviting them in the surgery room or something, of course. But we try to do everything in front of the clients. But we have a couple of patients, and the owner is aware of this, that we have to say, can you step outside the room and just wait outside the exam room while we do this procedure, while we draw the blood or give the vaccine or something like that. And because the owners are so distressed and so worried, the dogs pick up on it and they become almost impossible to handle. As soon as that door shuts, we do like a count to 3, and then we can often do whatever we want without these dogs flipping out. So how do we reduce fear, anxiety, and stress? First, we have to recognize it. And it isn't always the dog cowering in the corner or the cat that doesn't want to come out of its cage that are fearful. Okay. Sometimes overly friendly dogs that are very intense in their interactions with us or overly excited about accepting treats out of our hand are often manifesting signs of anxiety. We had a golden retriever in yesterday. This dog would have stood on its head if I'd asked it to. It was so worked up, and I would hand it a treat, and it would take my treat in 3 fingers at the same time. And it was just, but try to do something to it. That dog was flipping out. And this is one of the dogs that we had to have the owner walk out of the room. In fact, from previous visits, we walked in and she said, don't forget, I can't be in the room when you do a procedure on the dog. And aggressive dogs and cats are often just as fearful. Facial expressions can be used as a gauge of fear as well. And that takes a little bit more practice, but dogs looking at you with what they call the whale eye, where you're seeing the big whites of its eye and kind of giving you the side look. Wrinkled lips, the connoisseur of their lips will get pulled forward, almost like in a frown. And we have to see shelters and veterinary clinics from the animal's point of view. They were walking into a facility and out of their natural element. And this goes for foster homes as well. Everyone's unfamiliar. If there's other animals there, that heightens it. They don't know why they're there or what is being done to them. And they may remember a previous incident that caused pain at a shelter or a veterinary clinic. So to prevent it, as I said, it's way beyond the scope of this lecture to cover every aspect. But Fear Free is out there with tools for recognizing and attenuating fear and anxiety. So you should join it. Fear Free for veterinarians, we have to pay for it, but Fear Free for pet owners is free, and you can join and you can learn a lot about these tools. So there's some steps that you can take right away, especially if you're running a shelter or fostering an animal. Pheromones, okay? We have, there are dog pheromones. The name's escaping me at the moment. We have cat pheromones. They have collars. They have diffusers that you can put in the room. There's anti-anxiety medications, but not tranquilizers. We have a lot of clients that come to me from other clinics and say, my old vet used to give me acepromazine for, thunderstorms and fireworks. Can I have some? And I'm always, no, that's a tranquilizer. Acepromazine is nothing but a straitjacket. So your dog is bound up with him still inside of his own head and still just as fearful. We have to look at anti-anxiety medications, things like trazodone, things like Xanax. Distraction, treats, and more treats. I've never had a really good luck with thunder shirts. Some people have found that helps. If you have one and you want to try it, go ahead. I don't really recommend investing in it unless you've had more success than I have. So just as kind of a reminder and as an introduction to the next part, we have these emotional, affective, cognitive, sensory, and reactive outputs from the input of pain. So what is this thing called pain? Pain has a distinctively unpleasant affective quality. It becomes overwhelming, demands immediate attention, and disrupts ongoing behavior and thought. And pain is not just about how it feels, it's about how it makes you feel. And I think I'm going to add even one more thing. Pain is what the patient says it is. So in humans, just like we have Joe Cameron that can't feel pain, there are a subset of populations that feels more pain. There are some blue-eyed, red-haired Scots, usually female, that feel pain way more intensely than the general population. And what about those dogs that, everyone calls them, and I hate this term, it's just being a drama queen, like Shelties. I think Shelties feel pain more than other dogs, and that's why they react the way they do. So again, it's not just, it's the pain is what we say it is, and the pain is what the dog tells us it is. Going back to the human side, people with chronic pain report that most, if not all, aspects of their lives are significantly affected by chronic pain. Probably many of you have had chronic pain issues, and you start to feel worthless. You're tired all the time, but yet you can't sleep, etc. And our animals are no different. So let's talk a bit about quality of life. And this is something I used to just talk to veterinarians about, this system that's out there. But if you're aware of Zoetis, it's like the largest veterinary drug company in the world, and they have just bought this this device that came out of Glasgow, Scotland, and it helps measure it with a questionnaire. So we haven't seen the final form of this yet, but I'd like everyone to kind of be aware of it. And so we really want to look at health-related quality of life. And this is what this is doing. It's concerned with those aspects of quality of life change as a result of ill health and medical interventions, including things like osteoarthritis. So how do we measure it? This thing that's coming out, it's a structured questionnaire, has a formal scoring methodology, and it's all computer-based. It's either generic or disease specific, and it's been owned by a company called Vetmetrica. I think it will probably keep the same name. Zoetis will be in there somewhere, but it's a health quality questionnaire that is structured for dogs and cats, and it takes about 5 minutes to complete. And there's going to be, at least with Vetmetrica, there was a fee for it that the veterinarian usually paid and then passed on to the owner. And there's some questions and so forth, and that's not really important to know. But they look at things like, how energetic and enthusiastic, how calm and relaxed, things along that line. So I want to start to finish up here with a video, and you may or may not have seen this. This video was produced by a colleague of mine in Great Britain named Hannah Capon, and it's very hard to watch.
How can I be of help? Can you describe how you're feeling to me? Okay, can you show me? Can you point to where the problem is? I'm afraid I can't help if you don't tell me. Stop. You're in pain.
Okay, I always get a little teary-eyed when I watch that. It's what we as veterinarians have to deal with all the time, and especially because these dogs obviously don't walk in by themselves, but sometimes the real struggle is to convince the owner that there's something wrong. So this is my daughter's cat, Tulio, and I want to open this up to questions. But before we do that, I wouldn't mind just putting in a little bit of a plug for those of you in Michigan that might be watching this. So it's not about dogs, but it's about cats. And very recently, a congressman from Ypsilanti introduced a bill to outlaw declawing in the state of Michigan. Unfortunately, the Michigan Veterinary Medical Association is totally against an outlaw, as are about 50% of veterinarians. And I don't really understand why, because cats with claws are much easier to work with than cats that have been declawed. Cats with claws at most will swipe at you. Cats that have been declawed will try to bite. So, there's no real reason for it. And for those of you who work in shelters, you know that it is sometimes very hard to place a cat that has already been declawed. So talk to your representative if you're in Michigan and say, please support the anti-declaw bill. So my only little political thing. So do we have some questions that have been sent in that I can help answer?
Dr. Petty, I'm still wiping tears from the video. It was so powerful and hard to watch, but such an important message. So, and everything, I was trying to drop some links on a few of those incredibly important and valuable information that you were sharing with the group. We do have a couple of questions and comments, and please, for those of you who've been tuning in, feel free to drop yours in the Facebook comments or in the Zoom chat. Just a comment from Julie on Facebook. She just wanted to express her appreciation, Dr. Petty, for this, saying that it's such an important topic for all pet owners. They adopted a 10-year-old German Shepherd who had bilateral CCL tears that were unrepaired and whose leg muscles had atrophied. And they got her into rehab and pain control and said she was just like a new dog inside and out. So it was a lot of time and effort to stay on top of the pain, but absolutely worth it. So I think she was just sharing her testimonial on how important this is.
Well, Julie, I'm glad that you recognized there was an issue and you sought out help. So thank you.
Definitely. And then another question came in. Any thought in pain management about using veterinary social workers to coach owners? And this was related to when you talked about pet owners like myself who cause so much distress in the pet, they have to leave the room. So what are your thoughts about using veterinary social workers to coach owners?
Yeah, so I mean, that's okay, but you have to realize that oftentimes, it takes 10 minutes and $10 and an internet connection to get that kind of a certification. So just be careful. Always, whenever you're using someone, make sure they actually have been trained, that they actually do have a degree, whatever it might be. And I mean, there's a lot of dog trainers out there that can really, really help. The veterinary behaviorists, they're overwhelmed, and they usually only get the really bad cases because it's very expensive to use them. But yes, I'm happy to work with anyone that can do that.
Okay, wonderful. And Patty on Facebook asks, first of all, comments, very, very thought-provoking information. Thank you. Please advise, what is the holdup on the U.S. approved arthritis medication? I think it was Librela, was that?
Yeah, Librela. That's the one that I kind of snuck back across the border from Canada. Actually, I told him, he said, did you buy anything? I said, yeah, some arthritis medication for my dog. He's like, okay, have a good day. But I gave my dog that injection. The holdup is, so it's been in the EU for 2 years, and the holdup has been the FDA, blame it on the pandemic. The FDA, everything kind of came to a screeching halt. They really concentrated on getting pandemic-associated drugs approved and researched and so forth. So a lot of things like the cat equivalent, Silencia, we've had now for well, I've had it for a year. I was one of the developers, so I got it a little earlier. But again, that was in the EU because they were just moving things along a lot quicker. So, and as much as I see people bring me more arthritic dogs, even though it might be more prevalent in cats, I was kind of glad the cat one came through because we had 0 drugs for chronic OA pain in cats. So I was happy to see that one come by a year ago. Now that I've used this on my own dog, I'm on pins and needles till I can get it.
Yes. Any guess on when that might be approved for the United States?
So my friends at Zoetis tell me it has been approved. It was approved early May. They are now putting it into production because obviously they don't want to produce millions of dollars worth of drugs and then have it expire because the approval didn't go through. So now they are in production, and they said they think they will have enough for a general release sometime in October.
Okay. All right. We will wait for that very anxiously. It sounds like it would be a big help for many of our beloved pets. Allison asks, how can I keep learning more? What ongoing courses might be available for non-DVM on pain and older dog care? By the way, I did drop a link for Dr. Petty's book, which is great reviews on Amazon. So I did drop a link. I think that's one good place that we could all grab our copy. But in addition to your book, Dr. Petty, what other ongoing courses do you recommend for just the non-veterinary professional?
Sure. So one comment about my book. So it was published in 2016 in veterinary medicine. That's ancient history. And there are things that have changed. There's a lot of information in it that's still helpful, but there's also new things that aren't going to be in that. I would get and I can't remember the exact name of it. It's like fear-free family homes or something like that. I would join that because they are going to have some educational materials that you can watch, videos and so forth. And I'm always, Marty Becker is a buddy of mine that started it. And I'm always bugging him more and more pain stuff has to be on there. So, and he's making an effort to do so.
Wonderful. Thank you again, Dr. Petty. We did drop a link for that fear-free into the chat if you happen to be joining us on Zoom, and hopefully we can also share that via Facebook.
So one other possibility, and I haven't looked at it lately, but I know the International Veterinary Academy of Pain Management, IVAPM.org, has links for pet owners to learn more about pain.
Excellent. I will drop that also in chat after I introduce the next question, which comes from Melanie. She said a couple of years ago, unfortunately, she had to euthanize her Corgi Beagle mix, who was 13, because of severe arthritis. They tried acupuncture, laser, medications, and for her, nothing worked. Even the vet said there was nothing further that we could do to help her. But she always looked happy and never seemed in pain. And so Melanie is asking, do you think there was anything else we could have tried to lessen her pain before we made the decision to say goodbye? That's a tough question.
Well, I don't want to second guess what your veterinarian saw because, I don't know what the x-rays look like and what the situations are. I mean, there are more advanced things like injections of platelet-rich plasma directly into the joints, stem cell therapy, and so on that have shown some benefit. But these start to become more extreme treatments with limited benefits. Not limited benefits. If it works, it works. If it doesn't work, it doesn't work. But you have to keep doing it over and over again. So, in terms of appearing happy, there are certain dogs, and I think corgis are in that group. Corgis, golden retrievers, where every day is an adventure, even if they're in pain. And some of these, sometimes these are the hardest dogs to figure out that they are in pain. I mean, it's really observing them unable to do things anymore. So don't second guess yourself. It sounds like probably you and your veterinarian did all the very reasonable things and maybe even beyond reasonable with some of the more non-pharmaceutical things that you did. And you can't help everyone. And that's the sad part.
Certainly true. And Melanie, we all feel for you, because we know that's part of the grieving process, is we always look back and ask ourselves, what more could we have done? But it sounds like she had a wonderful 13 years and you did everything to help her. So our thoughts are with you.
And if I can just add my own personal experience, I have, with all of my dogs, no matter what the situation is, I've always had to have someone in my family look at me and say, it's time to stop. You're not going to make the dog better. So even me that works with this stuff all the time, sometimes it's very hard for me to say, enough's enough.
Very helpful to know. That certainly makes us feel better too. Allison just wanted to confirm that the seminar was being recorded to watch it again, because so much information was valuable. And yes, absolutely, it is recorded and is available on graymuzzle.org, like all of our other past webinars. It usually is posted within a day or two of this recording. So thank you. Please do check that out. And no other questions on Facebook. If you have time for one or two others, are nail trims, outside of quicks that get hit, are nail trims painful for dogs? We see so many that just completely go crazy over getting nails trimmed.
Right. So yeah, nail trims are very anxiety producing. So any dog, even if you're not trimming their nail, if you hold their paw still, most dogs, even if they've never had a nail trim, most dogs will struggle and react and become fearful. They just don't like that feeling of being trapped. On top of that, if you hit a nail too short one time, they have that memory forever and they're going to be reluctant. We actually don't do nail trims at my clinic. We send them to a groomer. The groomer probably is a little bit better at it than I am. The only time we do a nail trim is if it's a medical nail trim or the animal's already under sedation or anesthesia. And it's because of that fearful response. We don't want a dog walking into the clinic worried from the minute it hits the front door that this is all about a nail trim. And since we quit doing nail trims like 12, 15 years ago, that's been our experience. The dogs are just happier walking through that front door.
So interesting. So interesting. And one other question, of course, this is very helpful information and of steps that pet owners can do for their pets once they notice those signs of pain. How about those preventative measures? What can we do to prolong that arthritis from setting in, or just to
weight loss? Yeah. Just like our physicians always tell us when we go in, it's all about diet and weight loss, and it is. So keeping a healthy weight on your pet, and an overweight pet that loses 10% of its body weight has the equivalent effect of taking an NSAID like Rimadyl or Metacam or Daramax. So that's pretty profound. So that's a non-pharmaceutical thing to do. Try to keep the dogs active, whatever it is that they can do to keep the muscle mass up. The sad fact is just like us, as they age, every year that goes by, they lose another percentage of their muscle mass. So it's important to keep really active. The other thing I think is diet. One of the biggest strides that we've had in veterinary medicine is diet. And I'm not going to call out any dog food companies, but instead what I'm going to tell you, and I'm going to spend a couple minutes doing this, is that the World Small Animal Veterinary Association has something called a Global Nutrition Council. And they have said there are only 4 dog food companies in the world that consistently meet high standards. Okay. So those 4 companies are, and everyone's always shocked at the first one, Purina, Science Diet, Royal Canin, and Iams. And why is this? If you take your dog food and look at the side label, whatever brand you have, and it's not one of those, there's this tiny little thing. So you know what? Dog food companies can say what they want to on the front of the bag. They can say, if you feed your dog for this for 3 months, your dog can fly. They can say that, and there's nothing wrong with it. It's considered marketing. So there's one area that they cannot lie at. They can lie on the ingredients. They can list So for example, one dog food company that's very popular, you see them on the TV all the time. Our main ingredient is chicken. But what they do is they weigh the chicken before it's dehydrated, and then they dehydrate it. So yeah, they're calling all the water that's in the chicken part of the chicken, and it's not. Okay, most reputable companies look at the dehydrated state. So so they can lie on the ingredients by manipulating that. They can also, there's this little thing down there called the AAFCO statement. It's all capital letters, AAFCO. And they have to tell the truth on this or they get shut down. And there's two things you need to look for. One, you need to see that it was tested. The dog food was tested. You don't want to see the words formulated. So let me compare that. If you went to buy a brand new car and you said, what's the crash study data like? They'll say, well, we tested it and this is how it is. But would you buy that car if they said, well, we just formulated it to guidelines and we've never actually crash tested the car? That's the dog food that you're buying when you buy formulated. They have never tested it. Your dog's the experiment. The other thing that you need to be aware of on the AAFCO statement is life stages. If it says all life stages, that is a one size fits all, and you are feeding your dog puppy food, because it means it has to address the most, actually either puppy food or lactating bitches. Those are the two most highly caloric, needy life stages. So, people are like, I'm on this like adult senior dog food and it's still gaining weight. But if you look at the thing, it says all life stages, you're feeding puppy food. So they're getting too much calcium, too much phosphorus, all these other things. So kind of a long-winded way of saying, pick a reputable dog food company. And I'm sure I have burst the bubble of a lot of the people listening to me right now. And maybe some of them are leaving and looking at their dog food bag.
Yes.
But it just drives me nuts that these companies are able to get away with this.
It's so helpful. I'm with Allison. I even couldn't take notes fast enough to capture all this valuable information. Dr. Petty, thank you so very much. We have folks that are joining us from every corner of the United States, New Jersey and California, Florida, Georgia, Wisconsin, New Hampshire, Pennsylvania. And if anyone is in the Canton, Michigan area, you are very fortunate to have an incredible veterinarian in your backyard. So thank you so much, Dr. Petty. We are very grateful. What a fantastic webinar. It will be posted on our YouTube channel and on graymuzzle.org. Thank you again for sharing this valuable information. Thank you to all of the webinar joiners and for supporting Gray Muzzle Organization, helping us to set another record-setting year, helping 90 animal welfare organizations with $848,000 in grant money. Thank you all so much. We look forward to seeing you on the next one. Thank you again, Dr. Petty. All the best, everyone.
Bye.
Bye.